ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein. Doctor, thanks so much for joining us this morning.
Of course, great to be here, Phil.
Good to have you. You just heard in Trevor's story there, 3 Americans are testing positive for COVID every second. And I know we can find stats like this all over the place, but as an epidemiologist, what is your reaction to that specific number?
Yeah, I mean, these numbers are absolutely staggering, especially if you think about the fact that we're 2 years into the pandemic. We have so much knowledge. We have all the tools that we've accumulated. And now we're at a peak beyond where we were even last January, 277,000 new cases a day on average. And we know that there's backlogs from the holidays. We have to interpret this data cautiously, but we also know this is the most transmissible variant yet. And with holiday gatherings and travels, it is a recipe for increased amount of transmission. And this is going to continue probably into the weeks into January. And so this is why this is a reminder. These next few weeks are going to be challenging. It's also a reminder to double down on the things we know: boosters, social distancing, masking, limiting gatherings, improve ventilation. If we can try to do those things for a little bit longer, we can get on the other side of this Omicron surge.
The World Health Organization warning of, and using a really strong word that evokes fear, warning of a tsunami of new cases worldwide. And here in the U.S., new cases are higher really than they've ever been during the pandemic. But here's the thing, deaths are down. We are now about to enter, as you point out, the pandemic's 3rd year. What promising signs do you see that we could be coming out of the worst of the pandemic, if there are any?
Yeah, there's a lot of hopeful data. And I think, what we're seeing in the UK and South Africa is promising, is that, this Omicron variant leads to 2/3 less risk of hospitalization compared to Delta. And what we're seeing also in the US is that while we're seeing an increased rise in hospitalizations, it's nowhere near what we saw before. This correlation between hospitalizations and cases, it's doing something what I call decoupling. It's not the same level of correlation. And what it tells us is maybe we're entering this endemic phase where this virus does not cause the same level of severe illness and death. We just don't know quite yet. That is what the promising sign is. But again, just let us get through these next few weeks. And I am very hopeful that we may be in a much better phase of this pandemic.
So this new clinical trial out of South Africa shows that the Johnson & Johnson booster shot provides pretty strong protection against severe disease from Omicron. And in the beginning, people were saying, I'd rather get Moderna or Pfizer than Johnson & Johnson. The efficacy was different. The percentages were different. It was one shot. What does this study mean for all those who have the Johnson & Johnson shot?
Yeah, I think this is really good news. And what it shows is the J&J vaccine was always safe and effective. I think that was always clear. The challenge was it was a one-shot vaccine. And why we wanted one shot, it was better from an access perspective and a confidence. People didn't want to take 2 shots. But what we're clear now is 2 shots is better than 1. It's not necessarily based on the brand. And that's what we're seeing with J&J. So it's hopeful data for those who had the J&J vaccine. That they also released studies that showed that if you boosted with J&J on top of Pfizer, you could get a really important response, maybe even better than boosting with an additional Pfizer. It just reaffirms the fact that these were very good vaccines, but they were 2-dose vaccines to begin with. And so, again, for people that were getting the J&J shot, they should feel really good that they got strong protection, especially against the Omicron variant.
Dr. John Brownstein, always feel much more knowledgeable after speaking with you. Thanks so much. We appreciate it.
Thanks so much, Phil.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.